We want to bring you the facts without hype from an expert. So let's bring in Dr. Salles. She's a surgeon and scholar in residence at the Stanford School of Medicine. Dr. Salles, thank you so much for taking the time. White House coronavirus response coordinator Dr. Deborah Birx said people shouldn't be going to the store or pharmacy unless essential. Why should people be hunkering down even more so now when we've seen some positive news, albeit small, including a possible plateau of deaths in New York?
Well, I think anytime we see good news, that means what we're doing is working. It doesn't mean we should stop doing what we're doing now. If we stop the strategies that are currently working, we're likely to see an increase in the number of new infections and deaths. So if we found something that's working, which I think that we have with social distancing and having people stay at home, we should keep doing that.
We've heard a lot about hydroxychloroquine, the anti-malaria medication that's currently being studied as a possible treatment for COVID-19. President Trump has touted it and said at this point, quote, "What do we have to lose?" Can you explain why some medical professionals are hesitant to use it and maybe walk us through how it works, its impact on the immune system, and some symptoms?
Sure. I think it's first off important to remember that the president is our president. He's not a physician and he's not qualified to give medical advice. The way the medication works on a basic level is it interferes with the body's immune system. And the way that it's typically used outside of the current pandemic is to treat people who have autoimmune disorders, where their body's immune system is attacking their own tissues. And because it kind of interferes with that process and changes the body's immune response, it has impact in those diseases such as lupus or rheumatoid arthritis. When people start talking about using it for everybody all the time in the current pandemic, the reason that's bothersome or worrisome is a couple things. One is the data that we have are really minimal. They're somewhat promising, but they're pretty minimal, and they're for patients who already have COVID. So there is not really any data that's showing that for just any old person out in the world that they should start taking these medications. The data that we have for patients who have COVID, as I said, is promising, but it's based on very small studies. For example, one of the studies had 26 patients, 4 of whom ended up dying within a few days of starting on the medication. Which is 15% of the patients. So I wish that we had a cure-all, but we don't. And that's why physicians are not recommending that everyone start taking those medications. Another reason, or 2 other reasons I should say, to not have everybody taking them is one, they have, and I'm saying they, by the way, because often people will talk about hydroxychloroquine and chloroquine and or azithromycin. So that's what I mean by they. But when all of these medications have side effects and they interfere. So hydroxychloroquine in particular, we know interferes with the way our body metabolizes or processes other common medications that people take. For example, metoprolol is a medication that a lot of people are on for blood pressure or heart rate control. And we know that there can be problems with heart rhythms and changing people's heart rhythms if people aren't monitored. So there are side effects like that, or nausea, vomiting, other gastrointestinal issues that come up. So that's one reason. And another reason is that these are medications, in particular hydroxychloroquine and chloroquine, that real people need right now to manage their autoimmune problems. There's not enough supply for people to have their treatment that they need that's proven to be effective for them, and for everyone in the world to also be taking these medications. So we have to be thoughtful about balancing the risk and benefit for every patient and also across the system.
The CDC is reportedly beginning antibody testing. What is it? And is it accurate at this point? Is it possible that in the near future people could be tested to see if they're immune and then be able to return to work?
Yeah, so this is a new test that they're developing. Basically, the way that it works is it looks for evidence that your body has been exposed to the virus. So in the same way that if you got a vaccine for chickenpox or measles or hepatitis B or anything like that, and then you had someone check to see if your body had developed the appropriate response, that would be checking for these antibodies. It would be checking for antibodies to chickenpox, measles, et cetera. So the idea is that if we use an antibody test for the coronavirus, we can look and see who has developed antibodies against the virus. And the only way you develop those antibodies is to have been exposed. What we don't quite know yet is if people have developed those antibodies, are they immune? Now, it's usually the case for other conditions that we talked about. That's why we have vaccines for all of those things. But we don't 100% for fact know that people who've been exposed to coronavirus will be immune. It seems reasonable to think that they might be. And when we look ahead to how do we ever establish our economy again, how do we let people go out into the world again, it does seem reasonable to start with those people who've already had an immune response and developed the antibodies. As for how accurate the test is, I have not seen any data released on that yet.
Thank you so much for helping us understand all this. Obviously, everything is changing seemingly by the minute. Really appreciate it, Dr. Salles. Thank you so much. Now, have we check in with some of our sister stations across the country? We head to one community not under a stay-at-home order to see what life is like.